As you know, we have seen things change in the last few days. There are still many things we do not yet know about Omicron and its impacts on the healthcare system and on people in British Columbia and around the world. I've spent quite a bit of time with colleagues, talking with experts from around the world and watching what is happening globally. As I mentioned last Friday, we were putting together a puzzle, and it still has a lot of spaces and holes, but some things are becoming very clear. One of those is that Omicron is definitely spreading rapidly and is more transmissible than what we have seen with the Delta variants that we've been managing over the last few months. In addition, we're seeing it now rapidly replace Delta as the predominant variant that we are seeing causing illness here in British Columbia, and particularly in the areas that have high populous areas that have had low rates in the past little while in Vancouver Coastal and Fraser Health. There are some things that we don't yet know the details of, and one of those is severity of illness, the potential for significant impacts on our hospital system. And I don't need to say how fragile and how stretched our health care system is, from the community, from long-term care, assisted living, into our acute care facilities at all levels. We know that people have been working very hard. Healthcare workers, whether they're doing case and contact management, testing, tracing, whether we're working in the immunization clinics, in our hospitals, in our long-term care homes. As cases go up, we are stretched more and more. We need to take measures to make sure that we mitigate any impact on our healthcare system. And over this past weekend, it's become clear that our best case scenario about how Omicron might be different in terms of severity are looking less and less likely. We have seen an increase in hospitalization in places like the UK that are ahead of us in terms of transmission of Omicron. And more recently and closer to home, we've seen this as well in Quebec, which is very concerning. We are seeing the replacement, as I mentioned, of Omicron from Delta, and we're also seeing what we call explosive outbreaks, which have to do with larger numbers of people being exposed at the same time, but also a shortening of the incubation period that we're seeing. So the transmission between generations is shorter, and we've seen that around the world as well, in places like Copenhagen, and looking at specific outbreaks in the United States and here in Canada. Those are things that are worrisome to us because it can signal a dramatic impact in a short period of time on our hospital capacity. As well, we have seen increased evidence of immune escape. Basically, this virus is much more easily able to infect people who have been infected with previous variants of COVID-19, and more easily able to infect people who have been vaccinated, although it's still a magnitude difference from people who don't have the protection that vaccine offers. So some of the information that we have used to make the decisions about the measures that will be in place today are looking at what we're seeing here in British Columbia. And really it is about buying us time to understand and to prepare. The consequences of not slowing things down, of not taking these actions, are just too dire. We need to protect our healthcare system for everybody who needs care.